Dr. Harkanwar Gill, MD, is a board-certified physician whose work in general surgery, radiology, nuclear medicine, with specialization in vascular and interventional radiology has positioned him as an expert in minimally invasive, image-guided treatment. His clinical and academic contributions reflect a commitment to precision, collaboration, and patient-centered care. With extensive experience across several interdependent specialties, Dr. Gill offers a unique perspective on the future of medicine and the growing role of minimally invasive therapies in improving patient outcomes. This interview explores his journey, his philosophy, and the treatments he specializes in, as well as his long-term vision for expanding access to technologically advanced care. Much of his professional foundation can be seen in his bio, which highlights his career, educational contributions, and future aspirations. His PowerPoint presentation provides further insight into the treatments he offers and the conditions he focuses on, including prostate artery embolization, uterine fibroid embolization, hemorrhoid artery embolization, geniculate artery embolization, kyphoplasty, and venous disease management. When speaking with Dr. Gill about his work, the depth of his clinical training becomes immediately clear. Unlike many specialists who focus on a single discipline, Dr. Gill's path spans several foundational areas of medicine. He believes this multidisciplinary background is one of his greatest strengths. In the interview, he explained that general surgery taught him to understand disease anatomically and to think in terms of mechanism and repair. Radiology and nuclear medicine refined his ability to interpret imaging with a high level of precision. Interventional radiology then allowed him to merge these skills by offering treatments that rely on diagnostic accuracy and surgical strategy while avoiding the trauma of open surgery. His approach is rooted in seeing the entire patient, not just the disease process. This perspective is reflected heavily in his professional biography, which emphasizes his commitment to evidence-based practice, collaboration, and improving outcomes across a wide range of conditions. Dr. Gill specializes in minimally invasive procedures performed through tiny incisions using advanced imaging for guidance. These procedures are transforming modern medicine by reducing the pain, risk, and recovery time associated with traditional surgery. When asked why these techniques are so important today, he highlighted several key advantages. He noted that patients increasingly seek effective treatment options that do not require long hospital stays or general anesthesia. Many of the procedures he performs can be done with mild to moderate sedation, allowing patients to return home the same day. Conditions such as enlarged prostate, uterine fibroids, hemorrhoids, knee arthritis, vertebral fractures, and venous disease once required major surgical interventions. Today, in an appropriately selected patient population, many of these can be addressed through image-guided, catheter-based treatments. Dr. Gill's PowerPoint presentation outlines several of these procedures, including prostate artery embolization, PA, which helps reduce symptoms caused by an enlarged prostate by blocking blood flow to the gland and shrinking its size over time. The presentation also describes uterine fibroid embolization, UFE, geniculate artery embolization, GY, hemorrhoid artery embolization, HE, kyphoplasty for vertebral fractures, and sophisticated treatments for venous disease. In his interview responses, he emphasized that the ability to provide relief through small, well-targeted interventions is one of the most exciting developments in patient care. Although Dr. Gill treats a wide spectrum of conditions including trauma and general interventional procedures such as chemoport, dialysis access management, CT-guided procedures, but several core treatments define his work as an interventionalist. Prostate artery embolization, PA, is a minimally invasive treatment for benign prostatic hyperplasia, a condition that can significantly affect a man's ability to urinate. The procedure uses a catheter to deliver microscopic beads that block blood flow to specific areas of the prostate, causing it to shrink. Dr. Gill highlighted PAE's benefits such as using sedation, thereby avoiding general anesthesia, requiring only a pinhole incision, allowing patients to continue their medications, including blood thinners, without interruption, same-day outpatient procedure, and minimal adverse effects compared to surgery, especially without risk of harming erectile or urinary bladder function. This procedure is endorsed by American and European Urology Professional Society as well as Interventional Radiology. Uterine fibroid embolization, UFE, treats non-cancerous growths known as fibroids by similarly reducing blood flow to the affected tissue. Unlike surgical alternatives that may involve removing the uterus, UFE preserves the organ while relieving symptoms like heavy bleeding, pelvic pressure, and pain. Decades of research and trials has established UFE as a safe and effective first-line treatment option in women who choose to preserve the uterus. Hemorrhoid artery embolization, HE, offers a modern, less painful solution for individuals suffering from chronic bleeding hemorrhoids. Instead of surgically removing tissue, this novel technique uses small catheters in blood vessels to target the abnormal blood flow that sustains the hemorrhoids. This procedure is done with mild sedation, outpatient and same-day recovery with discharge. Interventional Oncology, IO is a subspecialty within interventional radiology which is transforming treatment for liver and kidney tumors. Dr. Gill provides complete care from tissue diagnosis to treatment and follow-up as part of multi-specialty tumor board for appropriately selected patients, thus avoiding surgery while destroying the tumor cells. These pinhole incision procedures block the blood flow to the tumor with chemo or radiation-loaded beads directly into the tumor or using heat, cold, cryoablation, microwave ablation, probes with image guidance. These are safe, efficacious outpatient procedures for complete tumor eradication. These procedures avoid side effects of traditional chemotherapy and abdominal surgery. Geniculate artery embolization, GY, provides relief for patients with chronic knee pain caused by osteoarthritis. By reducing abnormal blood flow to inflamed regions of the knee, this procedure can significantly decrease pain, improve mobility and sustain treatment response for several months to years, especially when compared to nerve or steroid blocks. Kyphoplasty for vertebral fractures. Kyphoplasty or cement augmentation stabilizes vertebral compression fractures, often caused by osteoporosis, and can produce immediate pain relief. It is far less invasive than traditional surgery, allowing rapid recovery. This outpatient procedure is well tolerated and can help patients to get off chronic pain medications including opioids, thus directly impacting personal and public health. Venous disease management. Dr. Gill also treats venous reflux, varicose veins, and clots through advanced image-guided interventions. In his current practice, he works alongside cardiologists as pulmonary embolism response team to remove large clots from the lungs which otherwise cause strain on the heart, worsening breathing and deteriorating quality of life. These treatments illustrate his ability to integrate diagnostic expertise with targeted therapy, ultimately offering patients personalized care with minimal disruption to their lives. Beyond clinical practice, Dr. Gill has made significant contributions to medical education. His biography notes his authorship of 2 book chapters in the past year and his involvement in mentoring trainees and residents. In the PowerPoint presentation, further details are provided, including his contributions to Brent and Helm's Fundamentals of Diagnostic Radiology, where he authored a chapter on medications used in interventional radiology, and another chapter on distal radial access for peripheral arterial procedures in a book showcasing advanced endovascular techniques. This publication includes contributions from top cardiologists, vascular surgeons, neurosurgeons, and interventional radiologists around the world, underscoring his belief in multidisciplinary care. When asked what motivates him to remain active in academia, Dr. Gill explained that medicine advances when clinicians share their experience and help others learn. He views education as a responsibility and an opportunity to elevate the level of care provided across the field. Dr. Gill's commitment to teaching is also a key part of his identity. He mentors radiology residents and medical trainees, providing guidance that extends beyond technical skills. In the interview, he explained that integrity, diligence, and respect for patients are just as important as mastering procedures. He encourages trainees to think critically, communicate clearly, and adopt a collaborative mindset. For him, mentorship is about shaping well-rounded physicians who are prepared not just to treat conditions, but to care for people. Throughout his discussion, Dr. Gill repeatedly emphasized the importance of multidisciplinary teamwork. Many of the conditions he treats intersect with specialties such as urology, gynecology, orthopedics, oncology, and vascular surgery. Collaboration allows each patient to benefit from multiple perspectives, leading to more precise diagnoses and more effective treatments. His work on advanced endovascular techniques, published alongside leading specialists across several fields, demonstrates his commitment to integrated care. He believes that working together not only improves outcomes but also fosters innovation. When asked what continues to inspire him after years of rigorous training and experience, Dr. Gill expressed that the core motivation has always been the same: helping patients regain quality of life. He finds great meaning in seeing individuals return to normal activities, relieved of pain and limitations that once impacted their daily routines. His work is grounded in responsibility and continuous growth, principles clearly echoed in his professional biography. Whether through clinical practice, research, or mentorship, he remains committed to making meaningful contributions to both patients and the broader medical community. Dr. Harkanwar Gill's career demonstrates how multidisciplinary knowledge, precision-driven treatment, and genuine compassion can come together to transform patient care. His expertise in minimally invasive, image-guided procedures is helping shape the future of medicine, offering faster, safer, and more effective alternatives to traditional surgery. Through academic contributions, resident mentorship, and a clear vision for expanding services in California, he continues to influence not only his patients but also the next generation of healthcare professionals. His dedication to collaboration, education, and innovation reflects a physician deeply committed to both the science and the humanity of medicine. As minimally invasive technologies evolve, experts like Dr. Gill will play a pivotal role in ensuring that these advancements translate into real, lasting benefits for the communities they serve.